Hello, my name is Rob Dekerlegand. I'm an associate professor in the Department of Physical Therapy at Thomas Jefferson University over here in Philadelphia. On behalf of myself and my co-author Malachy Clancy from the Department of Occupational Therapy, also at Thomas Jefferson University, I'm delighted to share a summary of our current recent publication titled Interdisciplinary Challenges in Long COVID Rehabilitation, Insights and Opportunities. So this is a project that builds on our earlier work that we had published in the January 2025 special issue on long COVID in the Cardiovascular and Pulmonary Physical Therapy Journal, where we first reported some concerning gaps around clinicians' understanding of long COVID, as well as a general lack of awareness of evidence-based resources that are available to support their practice. Long COVID, we know, is a complex and chronic condition that affects millions of people worldwide, with symptoms that persist for months to even years, and it disrupts their daily life. So rehabilitation professionals, we know, play a critical role in helping these individuals regain function, yet for some reason translating evidence into practice still remains a challenge. In this present study, we sought to now better understand the perceived challenges that clinicians report in managing individuals with long COVID. In addition, we wanted to learn a little bit about how they access information to guide their care. These insights are really essential in that will allow us to improve rehabilitation outcomes and ensure the evidence-based care that we want to provide will reach those with long COVID to optimize their personal outcomes and clinical outcomes as well. So we conducted a cross-sectional survey of 2,700 randomly selected physical therapists, occupational therapists, and speech-language pathologists across 9 U.S. states that reported the highest prevalence of long COVID. And this survey specifically explored perceived clinical challenges and also the forums that clinicians utilize to obtain resources to support their care. Ultimately, we had 296 providers respond across the 3 disciplines, and they represent a diverse area of practice as well as experience levels. So when we looked at the data, our findings revealed significant challenges continue to persist in terms of rehabilitation for individuals with long COVID, with the top challenges reported being first, gaps in knowledge and experience. Over 60% of the respondents reported that they lacked knowledge and experience with long COVID, and this was pretty consistent across all of the disciplines. Second was diagnostic uncertainty, with nearly 43% of the respondents struggling to distinguish long COVID from other conditions. And interesting, this challenge was even present in those that are actively treating with more experience with the population. Next would be treatment and measurement barriers, with about 1/3 of our respondents being unfamiliar with recommended interventions, as well as a lack of awareness of standardized outcome measures to utilize for this population. So to help address these challenges, clinicians are telling us that they're primarily relying on more informal resources, such as professional networking and use of federal websites. Formal evidence-based resources, such as clinical practice guidelines, were actually more rarely used, with fewer than 16% of the respondents even being aware of the WHO guidelines, and even fewer of them actively applying them in practice. So most of the respondents indicated that they relied on discipline-specific resources, and these gaps really suggest that despite the growing evidence, translation of these guidelines and the evidence-based resources to practice still remains slow and fragmented, and these are the guidelines that can actually help expand knowledge and experience to this population. So some key takeaways that we can take is that, number one, we need education. Education is critical, and we need to get specifically targeted interdisciplinary initiatives that can help close the knowledge gaps, improve confidence and experience, and expand experience in managing long COVID. In addition, we need to improve accessibility to the resources. The evidence-based guidelines must be disseminated through channels that clinicians are already utilizing, such as professional networks and continuing education platforms. And then finally, collaboration matters. We need to break down silos that we can now between disciplines, so that we can really ensure comprehensive patient-centered rehabilitation in an interdisciplinary manner for this growing population. So we know that long COVID is not going away, and neither is the need for informed, coordinated rehabilitation care. So if we can address these challenges through targeted initiatives, we can hopefully improve outcomes and quality of life for the millions of people living with long COVID. So thank you for your attention, and we hope you find our results of our study valuable.